Respected doctors, teachers, and dear students, good evening, one and all. Starting with the fifth day of ProVision, the webinar series hosted by Father Muller Homoeopathic Medical College. Today, we have a unique topic with an eminent resource person. Since long, the Ayush systems are being practiced in India and is considered completely safe. Due to this, the Ayush drugs are available even as over-the-counter drugs, and this has led to improper use of our medicines. Also, the increased awareness about Ayush systems and thus the increased demand for Ayush drugs has resulted in increased degree of adulteration. This is where the concept of pharmacovigilance comes in. Even though this concept is in practice in modern medicine since long, it was only recently that it is incorporated to Ayush system. That is the importance of today's topic, relevance of pharmacovigilance in homeopathy. As the quote goes, there comes a time, there comes a person. Today we have amidst us a person who is most qualified, reasonably apt, and the right one to talk on this subject, Dr. A.B. Ram Jyothis. Dr. Ram Jyothis, a native from Ernakulam, Kerala. He has completed his BHMS and MD in the subject of homeopathic pharmacy with a gold medal from Vinayaka Mission's Homeopathic Medical College, Salem. He started his teaching career at Father Muller Homeopathic Medical College, Mangalore. And with a teaching experience of 13 years, he is presently the head of the Department of Homeopathic Pharmacy at Adhirashramam Homeopathic Medical College, Kottayam. He has undergone a number of trainings, including hands-on training in animal experimentation. He was part of a number of research projects, both as a principal investigator and co-investigator, funded by different institutions. He is a peer reviewer for International Journal of Homeopathy and Natural Medicines and the Journal of Evidence-Based Complementary and Alternative Medicine. He is appointed as a medical inspector by Central Council of Homeopathy to inspect colleges and is a subject expert in the interview board for Kerala Public Service Commission. He has rendered talks on the subject of homeopathic pharmacy at various forums and is a resource person for causality assessment and pharmacovigilance in homeopathy at National Homeopathic Research Institute in Mental Health, Kottayam. It is a great privilege to introduce Sir because he is my teacher and mentor. With this brief introduction, I welcome Dr. Ram Jyothis to ProVision, the webinar series. Sir.
Thank you, Dr. Vivek, for the interesting introduction.
Yes, sir. Over to you, sir.
A very good morning to all and welcome you to my small talk on pharmacovigilance. The term pharmacovigilance might have astonished you because when you think about homeopathic medicine, the common notion is it is devoid of any side effects. It is a safe medicine. Normally, common people think about homeopathy that it is a safe form of medication. Do it actually safe? Or what is the relevance of pharmacovigilance in homeopathy in particular and Ayush in general? So in this presentation, I am going to intrude into the intricacies of the different aspects of pharmacovigilance as well as its relevance in homeopathy. But before going in detail about the relevance of pharmacovigilance in homeopathy, you should have a fundamental idea about pharmacovigilance since the term pharmacovigilance is a new concept in Ayush in general. So it has got various dimensions. I'm trying to keep it very concise and simple so that how a practitioner, a homeopathic practitioner, can easily understand the concept of pharmacovigilance. And also, one of the primary objective of this presentation is the practicing doctors has to give some feedback to the system of pharmacovigilance, because it is a new venture of central government to collect the databases about the adverse drug reactions or related terms. So with all your consent, I am going to start with my presentation. This talk I am planning to have 5 sessions. That includes pharmacovigilance, definition and milestones. How we come to the concept of pharmacovigilance in the modern medicine as well as in the Ayurveda system. Next, the proceedings of pharmacovigilance. What are the proceedings which is followed in the system of pharmacovigilance, which we follow in the pharmacovigilance and related systems. Next is a Drugs and Magic Remedies Act and rules. It's a very important rule where we frame the pharmacovigilance and we implement the pharmacovigilance. Next, the term used in causality assessment. Maybe this word is a new word for practitioners. And at the end, I will describe about the role of homeopathy, adverse drug reactions in homeopathy, and why these adverse drug reactions. And actually, adverse drug reactions in homeopathy has a different perspective when you compare to the other system of medicine, especially the modern medicine. We are not having the concept of adverse drug reactions in modern medicine. It is different from what we consider in homeopathy. So that is the last part. So coming to my first session, definition and etymology. Pharmacovigilance is a word which is originated from two words, pharmakon, that is drug, and vigilia, to keep watch. That is the origin of the word pharmacovigilance. Now the definition of pharmacovigilance is, it is defined as a science and activities relating to the detection, assessment, understanding and prevention of adverse effect or any other drug related problem. This is a WHO definition, and we will go in detail about the terms which is used in the definition. Detection, what is detection, what is assessment, what is understanding and prevention of adverse effect, and other drug related problems. So before going in detail about the pharmacovigilance, we should understand some terms which is always associated with pharmacovigilance. Adverse event or adverse experience. So what is adverse event or adverse experience? Any untoward medical occurrences that may present during treatment with a drug, a pharmaceutical product, but which does not necessarily have a causal relation with this treatment. That means any event which is happening during the time of treatment, which may or may not have any relation with the drug, such event, such circumstances are known as adverse event or adverse experience. Another term is adverse reactions. We commonly call as ADR, adverse drug reactions. What is ADR? WHO technical report suggests that a response to a drug which is noxious or unintended and which occurs at doses normally used in man for the prophylaxis, diagnosis, or therapy of disease, or for the modification of physiological function. So both seems to be similar, adverse event and adverse reaction, but the difference is adverse event is any event which is happened during the time of treatment. May or may not have any relation with drug effect. But adverse reaction is, it should have a cause to effect relation between the event and the drug. So it is avoiding other circumstances or other event, only the drug and the event, drug and the effect, cause to effect. So that is the difference between adverse event and adverse reaction. Now, another term is unexpected adverse reaction. Unexpected adverse reaction is a nature or severity of which is not consistent with the domestic labeling or marketing authorization or expected from the characteristic of the drug. So during the process of drug development, the manufacturers may have noted some of the adverse reactions. They consider some of the adverse reactions, but when it comes to the market, unexpectedly some reaction may occur. Such unexpected adverse reaction can occur, and that can be concluded, that can be considered as an adverse drug reaction, but it is called as unexpected adverse reaction. Next is serious adverse reaction or event. A serious adverse event or reaction is a untoward medical occurrences at that any dose. It can be result, because it is a serious adverse event, it can result in death or requires any hospitalization or prolongation of hospitalization, or it may be result in a persistent or significant disability or incapacity which is life threatening. So these type of serious adverse reactions also can occur. So this is a related terms which we always associate with pharmacovigilance. Now we are going to see what are the milestones of the pharmacovigilance, how we reach the concept of pharmacovigilance. So it was date back to 1893 when Lancet, a famous medical journal, they initiate the foundation of a commission and starting collection of notification about the side effects. So during that time, only people bothered about the effect of the drug or action of the drug, but it is a first time a medical journal, learned people, they observe about the side effect, the other effect of the drug. So they initiate to observe the side effect. And later in 1936, in USA, that was the age of antibiotics, sulfur drugs were used widely, and they noticed some 107 lethal cases, and people, doctors started observing the effect of sulfur drugs. So that is a signal. See, usually in pharmacovigilance, we use the word signal detection. Signal detection means any adverse effect or any adverse symptoms. It may not be a complete event, but maybe a one symptom or a not a well-established symptom. So that is called a signal. So these signals are detected. And in 1938, US Federal Food and Drug Act required that pharmaceuticals should be pure and free at any contamination. That is the first time such a directive was released by Food and Drug Act, Food Drug Administration, that the pharmaceutical drug should be free from any contaminations. Coming to next, the notorious thalidomide tragedy, which happens in during the period of 1957 and 1961. Most of you know about the thalidomide tragedy. It was first entered in German market, and in 1957 as a over-the-counter remedy, and they advertised their product as a completely safe. The manufacturers, they advertise it as completely safe for everyone, including the mother and child, even during pregnancy. And they reassured that it could not find a dose high enough to kill a rat. So that was the disclaimer. And by 1960, thalidomide was marketed in 46 countries. And around this time, Australian obstetrician, he discovered that the drug also elevated the morning sickness. He started recommending this off-label use of drug to his pregnant patients. But many children in 1960s were born with phacomelia. You know, the phacomelia is it is resulting the shortening or absence of the limb. So after this tragedy, people were very conscious about the effect and side effect of the drug. So thalidomide tragedy is a very important milestone in the pharmacovigilance, as well as the adverse drug reaction, monitoring the adverse drug reactions. Okay, so in a consequences, in 1965, European Union issued a directive. It's the first time directive. It is called as pharmaceutical directive. This directive was a reaction to the thalidomide tragedy in early 60s, and aimed to establish, maintain a high level of protection for public health in Europe. So in Europe also, they started monitoring. And in 1968, World Health Organization pilot project started to pool the adverse drug reactions from the multiple countries. So that was the first time a World Health Organization started monitoring in a multi-centric way. As a consequences, as a result of that, Uppsala Monitoring Center was established in 1978. See, Uppsala Monitoring Center, they support the WHO program for international drug monitoring, which began in 1968 as a global response to the thalidomide tragedy. The program sought to collect information about the adverse effect of the medicine as from different countries, and they collect, they form a database which is known as VG base, and that is why Government of India, central government started a pharmacovigilance national center to form a database resembling like the database of Uppsala Monitoring Center, which is called as VG base. It is the largest database of adverse drug reactions, and followed by in 1997, ICH is the International Council for Harmonization of Technical Requirement for Pharmaceutical for Human Use. It is a unique organization which brings together the regulatory authorities and pharmaceutical industries to discuss on scientific technical aspects of the drug registrations. So ICH has produced a comprehensive safety guidelines to uncover the potential risk like carcinogenicity, genotoxicity, and reproductive toxicity, etc. So ICH has a very important role in bringing out the concept of pharmacovigilance. Now, next is post-marketing safety reporting, which is started in 2001. The FDA guidelines on how to report adverse events in post-marketing phase. Once a drug is marketed, we need to monitor the effect of the drug for a long time, and that is the longest period of monitoring the adverse drug effect, post-marketing surveillance. And so that was started in 2001. In 2010, European pharmacovigilance legislation passed. See how the concept of pharmacovigilance is a very new concept in modern medicine also. So soon after it comes in modern medicine, it comes to the Ayur systems also. Okay. In 2014, MHRA, good pharmacovigilance practice of medicines. It is a minimum standard of monitoring the safety of medicines on sale of public in European Union. And followed by that, in India, National Program for Pharmacovigilance was launched in 2005 and was renamed as a Pharmacovigilance Program in India in 2010. That is very important landmark in pharmacovigilance in India. It started in 2010 in modern medicine. Followed by that, a nationwide program under Central Sector Scheme funded by Ministry of Ayush. And they managed the database for adverse drug reactions, and it was collecting and the background scenario of starting a database for Ayush system is considering the growing use of Ayurveda, Siddha, Unani, and homeopathic products and medicine globally, including the traditional medicine in pharmacovigilance system, become equally important. And the worldwide movement for improvement of patient safety, WHO also recommend that patient safety, it gains momentum. The subject of drug safety becomes even more important. Pharmacovigilance is a science which is dedicated to reduce the risk of drug-related harms to the consumers. So it is a high time to deliberate regarding concerns of the traditional medicines, especially the Ayurveda, like classical Ayurvedic medicine, which found that some of the it is not passing the quality control test in some foreign countries, and so such concerns of the traditional and the classical Ayurvedic, Siddha, Unani medicines. So that is why government initiated to start to collect the database for the reports, the signals or drug adverse drug effects. So considering that, government started.
Excuse me, Dr. Ram Jyothis.
Yes.
Sir, your presenter view is visible to us, and the main slides are too small. I'm getting comments like that.
Main slides are small.
Smaller. Yeah, we are seeing your presenter view as such.
Okay.
Yeah.
So is it visible?
No, even your reference slides are visible to us.
Yeah, now go for screenshot. Screen.
Okay. Now it is visible.
Yes, fine.
Yeah. So these are the objectives of pharmacovigilance program in Ayurveda, Siddha, Unani, and homeopathic drugs. The first one is inculcating the reporting culture among the consumers as well as Ayush practitioners to facilitate documentation of adverse drug reactions. So that means there should be a reporting culture. So that is what we are lacking actually. When in a healthcare system, something happens, sentinel events, we call it a sentinel event, something happens, and if any adverse reactions occurs, many of us will like to cover the reactions or adverse drug reactions. So the primary objective of the pharmacovigilance program of Ayush is to inculcating reporting culture. Reporting culture is a very important thing among the consumers as well as the Ayush practitioners to facilitate the documentation. So the primary aim of the pharmacovigilance in Ayush system is to collect a digital database. So all the practitioners, that is why that is the very important aspect of this presentation. So all the practitioners, they should have a culture to report of their own signals. They detected some signals. So this is a pharmacovigilance term. Signals means any adverse reactions. So they have to report it to the higher authorities. The second objective is developing a system-wise database of adverse drug reactions of Ayush drugs and involving evidence-based recommendation regarding clinical safety. So that is about a system. I told you before, the primary aim of the government is to develop a digital database for Ayush systems. Next is the reporting of instances of misleading advertisement of Ayush system drugs for a regulatory action. So this also is one of the objective of pharmacovigilance, reporting of misleading advertisement, not only the adverse drug reactions, but also the misleading advertisement, which is given in Drugs and Magic Remedies Act or Objectionable Advertisement Act. And according to me, that is more important than adverse drug reactions as far as Ayush systems are concerned. So a lot of misleading advertisements are going there. So that misleading, that will mislead the common people, and that is a concern of the government. So the reporting instances, misleading advertisement of Ayush drugs, that should come into the preview of the regulatory action. So these three are the objectives of pharmacovigilance program of Ayush drug. Now, proceedings. So I told reporting. Reporting is one of the objectives of pharmacovigilance. Now, in the proceedings, so what are the proceedings? Proceedings of the reporting. So how we can go about in a pharmacovigilance program, what to report. So what for a practitioner, what he want to report, who can report, where to report, how to report, and once you report any adverse drug reactions, what is the sequelae, what is the fate of this submitted report. So this is what we are going to see in next slides. What to report? Any suspected, any drug related adverse event seemingly insignificant or common adverse reaction. So some may find that is a very common problem while reporting the adverse drug reactions by practitioners. So they don't know what to report because they don't have any culture of reporting. Many practitioners, when we interact with the practitioners, they don't know it is an adverse drug reaction or any signal. So how to detect the signal, how to find the signal, that is very, very important. So they may seemingly insignificant, may not have any cause to effect relations, or it may be a common adverse reactions. So they think that whether it is relevant to report, but any adverse drug events which may or may not be related to the drug, any cause to effect relation with the drug should be reported. Second part is any misleading advertisement in Ayush drug. So that is always a problem. We can see a lot of advertisement in print media, in visual media, etc., about the advertisement of the drugs, and many of these advertisement is prohibited by Objectionable Advertisement Act and rules. So we'll come to that later. Now, who can report? Anyone can report. Any healthcare professional can report the suspected adverse drug event to concerned peripheral pharmacovigilance centers or intermediary pharmacovigilance centers. I will explain that terms. Using suspected adverse reactions in a reporting form. There is a specified reporting form for Ayush drugs. So this is a hierarchy. I failed to, I think I didn't mention about the hierarchical order of the pharmacovigilance centers. There is a central pharmacovigilance center, followed by intermediary pharmacovigilance center. Then in the last part of hierarchy, it is the peripheral pharmacovigilance centers. So a National Institute of Ayurveda in the Delhi, that is a national pharmacovigilance center. In homeopathy, intermediary pharmacovigilance center is National Institute of Homoeopathy, and peripheral pharmacovigilance center, different centers are there. In Kerala, we have a National Institute of Research in Homeopathy. Mental Health is one of the center for pharmacovigilance center. So these are the hierarchical order. So any healthcare professional can report to the peripheral pharmacovigilance center. So always remember, you should report to the peripheral pharmacovigilance center. Where to report? The reporting on a prescribed format. There is a specified format is there, can be submitted to the nearby concerned peripheral pharmacovigilance centers. How to report? So there are two types of submission reporting. One is online. You can submit. This is a link for online submission, or you can download the reporting form either in Word or PDF form and fill it digitally and send via email, or print it, download it, then manually you can send. Okay, this is how we have to. There is no intricacies in reporting the adverse drug reactions. It is very, very easy. I will show you the format. This is a format for reporting. May not be clear. The form may not be clear, but I will read. This is a preliminary thing. Then description of suspected adverse drug reaction. So if you suspecting any signals, any adverse reactions, you can note it here with the date and time of initial observation, and description. What is the symptoms you observed? Then the list of all Ayush drug. In case of homeopathy, we can write the homeopathic drug used by patient during the period of 1 month. The last 1 month, which all medicine you used. The next column is a list of other drugs used by patient during the period of 1 month. Any other modern medicine or Ayurvedic or any other system of medicines. Details of drug suspected to cause ADR. If you are suspecting any of these drug, which is a cause of these adverse drug reactions, you can write the details of the drug here. Then management provide taken for suspected adverse reaction. So how you manage this adverse drug reaction? How you manage these symptoms? So that you can write. Then there is a column for indicating the outcome of this suspected adverse reactions. So this is the format. You can any healthcare professional can report to the peripheral pharmacovigilance center. Now this is the always comes along with the format, and this is filled by the coordinator at the peripheral pharmacovigilance center. So this is called as the ADR probability scale. So the symptoms or adverse drug reaction you reported will be analyzed by the coordinator, and he will score the symptoms according to this scoring system. And according to the scoring system, they analyze and they assess the adverse drug reaction like certain, probable, possible, unlikely, or unconditional, etc. So different methods of assessments are there. So if the score is above 9, then it is the assessment is certain. If it is between 5 to 8, it is probable. If it is 1 to 4, it is possible. If it is 0, it is unlikely. So, and I will explain each terms later. And this is called as causality assessment. And this is done at the pharmacovigilance centers. Okay. Now the fate of submitted report. Once you submit the report, so what happened to this report? So information from the peripheral pharmacovigilance centers will be monitored, analyzed by the coordinator there. Then after assessing the relationship, the causality assessment, it will be forwarded to the intermediary pharmacovigilance centers for causality analysis again. Then it will be forwarded to National Pharmacovigilance Center, and at the National Pharmacovigilance Center, they form a digital database for these adverse drug reactions, and they will submit to the Ministry of Pharmacy. Okay, so this is the procedure for pharmacovigilance processes. In short, now certain terms which is used to in the causality assessment. So we have seen how the scorings are concluded as a causality terms. Reported adverse drug reactions, it will be scored, and according to the score, we assess the causality. Okay. Is it audible?
Yes.
You're audible. Continue.
Okay. So the first one is certain. So the problem with this term is it is very closely related, and many of the assessors has difficulty to conclude whether it is a certain and whether it is a possible or probable because of this confusion. So we have defined each term in the causality assessment. So the first one is certain. Certain means that relation is very strong. The drug effect and the condition, adverse drug reaction, is very strong. The relation is very strong. Okay. A clinical event, including the laboratory test abnormality, occurring in a plausible time relationship to drug administration, and which cannot be explained by a concurrent disease or any drug or chemicals. The response to the withdrawal of drug, that is de-challenge, I will explain it, should be clinically plausible. The event must be definitive pharmacologically and phenomenologically using satisfactory re-challenge procedure if necessary. So here I will explain three terms. Plausible time relation to drug administration. So an event should have a plausible time relationship with a drug administration. So whenever you administer drug, the event occurs. So that is why, and it should be time related. How long the drug is continued, the event will be also continued. So such type of relation, if it is there, we can very well establish it as a certain. And another one is withdrawal of the drug. It is called as de-challenge. If you withdraw the drug, the event will disappear or the reaction will disappear. So that is called as a de-challenge. And again, once you withdraw, again you administer the drug. That is called as re-challenge. When you re-challenge it, again this event reappears. So these are the three important criteria to assess a drug reaction, adverse drug reaction as certain. The relation is very, very strong. It is certain. Now, probable or likely. So, what is the difference between certain and probable? A clinical event including laboratory test abnormality with a reasonable time sequence to administration of the drug unlikely to be attributed to the concurrent disease or other drugs or chemicals which follows a clinically reasonable response on withdrawal, and re-challenge information is not required to fulfill this definition. So the difference, hope you understand the meaning of this definition. I will tell the difference to assess it as a certain. You should have a plausible time frame relationship. It should pass a de-challenge criteria. It should pass a re-challenge criteria. So in probable relationship, there should be a plausible time relationship. As far as the drug is continued, the event will be there. Okay, so time relation is there. De-challenge is there. Once you withdraw the drug, the symptoms also disappears. But re-challenge, when you re-administer drug, the symptom may not appear. So such symptoms or such reactions, such events are classified as a probable relationship. Next is possible relationship. A clinical event or including a laboratory test abnormality with a reasonable time sequence to administration of the drug, but which could be explained by concurrent disease or other drugs or chemicals. Information of drug withdrawal may be lacking or unclear. So here, in certain and probable, a drug that particular drug should have a plausible time relation with the event. And in possible relationship, this particular event may have a relation with the drug, or it may be due to some other drug or some other comorbidity in the patient. Okay, it can be related to some other drug or the comorbidity of in that particular patient. So it may not have a strong effect, if cause to effect relationship with a particular drug. So such relations are called as possible, and re-challenge and de-challenge is not applicable here. Now unlikely relationship is a clinical event including laboratory test abnormality with a temporal relation with the drug administration, which make a causal relationship improbable. So here the cause to effect relationship is not so strong. It is improbable, and in which other drug or chemicals or underlying diseases provide plausible explanation. So it can be explained. This particular event or reaction may be due to some other diseases or some other drugs. So if you see, the possible or unlikely is very closely related, and one assesses are very difficult to differentiate between two. Conditional or unclassified means a clinical event occurring including the laboratory test abnormality reported as an adverse reaction about which more data is essential for the proper assessment. So with a single signal or single symptom, one cannot assess whether it is conditional or classified. So we need to get different signals. So that is a separate aspect in signal detection. So we may have to get a different signals from different areas. That is why to make a very strong digital database, it should be multi-centric, and that is why government has decided to make it multi-centric. There are, I think, there are 7 peripheral vigilance pharmacovigilance centers in homeopathy in India. So they collected the signal from different multi-centric areas. So if it is not reported from all the areas, it may be considered as a conditional or unclassified. Unaccessible or unclassifiable is the last one, the least one. a report suggesting an adverse reaction which cannot be judged because information is insufficient. So insufficient information is there. So that is classified as an unassessable one. So this is about the terms which is used in the causality assessment, and this causality assessment is a very important aspect in pharmacovigilance. So these symptoms are classified, or reactions are classified according to these terms which is used in the causality assessment. Now, next is the Drugs and Magic Remedies Act, or Objectionable Advertisement Act and rules. So why this rule is important? This is the third objective of pharmacovigilance, National Pharmacovigilance Center, that is the reporting of misleading advertisement. So I try to make it very concise because, you know, Drugs and Magic Remedies Act itself is a very big book, and I try to make it very concise. This act and rules, they are intended to protect the consumer and prevent the practice of misleading and extravagant claims made in respect of many medicines, and especially those claiming as remedies for many diseases considered at present as incurable. So in this act and rule, they have listed out several almost 54 medical conditions, or it is incurable, or it is not incurable, but the advertisement should not be done. So that is given in the schedule of this act. The objective of this act is to control certain type of advertisement relating to the drug, to prohibit the kind of advertisement relating to magic remedies which makes claims and are likely to mislead the public. So I will show you the conditions for the knowledge of practitioners. So these conditions should not be, and there are some saving criteria for these conditions also. Not that we should not advertise it, but saving clauses are, these conditions can be used any scientific communications. For example, any literary, any articles, such and such drug is effective in this condition. So in a scientific communication, we can use it, no problem. And to manufacturers, the communication from the pharmaceutical companies to the registered medical practitioners, this they can communicate such and such drug is effective in these conditions. So, but a clause should be there for the use of registered medical practitioner, okay, not for the common people. So such a saving clause are there, and these are the conditions. There are 54, the list is big, 54 medical conditions are there: appendicitis, atherosclerosis, blindness, blood poisoning, bright disease, cancer, cataract, deafness, diabetes, disorders of brain, then optical system, uterus diseases, menstrual flow. So this schedule is, this is a list given in the schedule: epilepsy, female diseases, fevers, I think almost all the conditions: glaucoma, goiter, heart disease, hypertension, hydrocele, hysteria, leprosy, leukoderma, lockjaw, locomotor ataxia. And when you see this list, we found that most of the advertisements are related to these conditions. So this is about the conditions for your understanding. Now coming to the last part of this thing, and the most important part of this presentation is the relevance of pharmacovigilance in homeopathy. So to begin with, we should know legally, because these pharmacovigilance and drugs and magic remedies act, or objectionable advertisement act, all related to the legal things, isn't it? So what is a legal definition of homeopathic medicines? Legal definitions. So I'm not reading this definition, but I will highlight the few important points here. So it should be included in homeopathic proving. It should be established through long clinical experience. It should be prepared according to techniques of homeopathic pharmacy. So these are the three criteria when a homeopathic medicine, when you call a drug as a homeopathic medicine, according to law, according to Drugs and Cosmetic Act. It should be included in proving, or it should be, the clinical efficacy should be established by clinical experience, and it should be prepared according to the techniques of pharmacy. Moreover, it also includes the combination of ingredients of such homeopathic medicine. So combination of homeopathic medicine is also included as a legal definition of homeopathic medicines, not only the single medicines. Okay, so combination also is included. So according to this definition, any patent product, any combinations, any mother tinctures, any lower potencies, higher potencies, anything can be called as a homeopathic medicines, and that is the legal importance of this. And one thing, another one is, and does not include a medicine administered by parenteral route. So the injections, which is injected to the blood, injections are not considered as a homeopathic medicine, at least in India. So we sometimes consider that herbal drugs are safe. It is a safe drug because it is taken from a plant, and you know, many of the very potent poisonous substances are taken from the plants. Even we consider the homeopathic medicine like a belladonna or an axomica or any type of medicines, these are herbal drugs but are potent poisons. So it is a wrong notion that herbal drugs are safe. Herbal extract versus mother tinctures. So what is the difference between a herbal extract and mother tincture? Lot of differences. So same difference is there in Ayurvedic preparations and homeopathic preparations, homeopathic mother tinctures. So I am more concentrating on mother tinctures and lower potencies because the ultra high dilutions are commonly devoid of any adverse drug reactions, but we should be very conscious to give in certain conditions. Even our masters have given, they have made conscious about giving high potencies in certain conditions. So all of you know that. Okay, so except that, most of the mother tinctures are, most of the adverse drug reactions are reported with lower dilutions or lower potencies and the prolonged use of mother tinctures. That is why I am concentrating it on mother tinctures and lower dilutions. Now, the difference between herbal extract and mother tinctures. So what is the difference between the mother tinctures? You know, it is the more diluted form. 1/10 drug strength is a drug strength of most of the mother tinctures except few. So it is comparatively safer than a herbal extract. Now the difference between isolated compounds and mother tinctures. So isolated compounds means the alkaloids of any phytochemicals isolated, and when you compare with mother tinctures are safe because of several reasons. I will explain it later. Okay, so these are the thing. The herbal drugs should not considered as a safe in a material dose. Now the phytochemical interactions in the mother tinctures. So why mother tinctures are safe? Same time it is unsafe. Mother tinctures are safer than herbal extract, but prolonged use of mother tinctures are unsafe because of this reason. These phytochemical interactions, you know, mother tinctures contains a lot of phytochemicals like alkaloids, glycosides, saponins, tannins, oils, etc. Isn't it? So these phytochemicals are responsible for the pharmacological action, and these interactions, the phytochemicals which is present in a mother tinctures, a lot of hundreds of phytochemicals may be present in a particular mother tincture. So these phytochemicals having some interactions. These interactions can be synergetic interactions or antagonistic interaction. What do you mean by synergetic interactions? Synergetic interaction is if one phytochemical facilitate the action of the another one, then it is known as a synergetic action. Okay, so it conjointly acts. It conjointly acts. So that is called as synergetic. Whereas antagonistic relationship means the when the action of a particular phytochemical, what a particular alkaloid will be antidoted by or decreased by some other phytochemicals which is present in the same drug, then it is called as antagonistic. So that is why sometimes these antagonistic relations may reduce the toxicity of the mother tinctures. When you prepare a mother tincture in a 1/10 drug strength, so we intended to give for some other conditions, and one phytochemicals may be responsible for that, and the toxicity of that particular phytochemical may be nullified by the another antagonistic phytochemical. So that may be the reason why mother tinctures is safe to use to some extent. So I have taken some example for some commonly used mother tinctures in homeopathy and their adverse drug reactions. Okay. So these are the I have enlisted some very few drugs, and so that which is very commonly used in practice. Hydrastis canadensis is a one drug which is used in a material dose in mother tincture form, especially in lower dilutions in a well-established pathological condition, especially in cancer. Some doctors use it in cancer. So we observe that it causes ulceration if it is used for a prolonged period of time, and some of the patients observed there is a lack of diminished vitamin B absorption, and it is contraindicated in hypertension. It will increase the blood pressure. So these are the adverse drug reaction signals we got it from several practitioners, and also from the some of the literature. So I will show the literature also where I've taken these things. The references are this. These are the references I referred for getting the adverse drug reactions of the hydrastis extract, and the extract and herbal extract and mother tinctures that does not have much difference. Only thing is mother tincture is diluted. And next one is Hemamelis virginia, which is commonly used to arrest the hemorrhage in material dose in mother tincture form. And according to the literature, we found that it contains saffron. It's a compound which is having a carcinogenic property, and also the tannic, gallic, and caffeic acid, which can cause cancer. So a prolonged use, overdose may produce cancer according to these literatures. So genotoxic and antigenotoxic effect of catechins and tannins from the bark of Hemamelis virginia. Okay. And another study is subchronic toxicity of study of gallic acid by oral administration. So which gallic acid is one of the constituent of Hemamelis. Okay. So such type of mother tinctures, always you use it with caution. Next is Cardus marianus. It is a very commonly used mother tincture for liver complaints, and we observe that according from the literature, it causes insulin resistance. It causes insulin resistance, and some people it may cause skin allergy. So these are some signals we got it from some literature. Okay. I'm not going in detail of the clinical indication of Cardus marianus, because our primary objective is to find out the adverse drug reactions in commonly used mother tinctures in material doses. These are the references. and Passiflora incarnata. This is also a material, a mother tincture, which is used in very massive doses. Very massive doses. I came to know that the Passiflora is used even the over-the-counter drug. The patient himself is buying from medical stores and using it for insomnia. And the dosage is 30 to 60 drops. Some people take. And one of the studies says that, see, I have highlighted it. A 34 years old female developed a severe nausea, vomiting, drowsiness, and prolonged QT, and episodes of non-sustained ventricular tachycardia followed by self-administration of herbal remedy, Passiflora incarnata, and they found that there is a causal relationship between the use of this medicine Passiflora to the symptoms developed in the patient. And this is a clinical observation. And they conclude that Passiflora incarnata was associated with significant adverse effect in this patient. So it is important to ask specifically about the use of herbal medicines in patients with the undiagnosed illness. So these type of observations are found in many of these toxicological and clinical toxicological journals. If you search for it, we can find lot of drugs which we use in mother tincture form in the which is reported side effects or reported toxicity. Because we are not concerned about the toxicity of the material drugs and lower potency so far. So we always consider the effect of the drug, the clinical utility of the drugs. So now it is a time to observe and monitor what we have given, even if it is a high potency also. So what are the symptoms? What are the things which we are not commonly acquainted with? So that things we can observe and we need to report so that we can make a very strong digital database. And one more thing in reporting of these symptoms is, so we have several remedy relations like complementary, antidote, inimical, etc. So this was recorded years back and it is written in Warwick or Kent, but we used to refer. But whether we can able to find out any new drug relations so far, any new drug relation. There are many relations, but when you observe it, then only you can find it. These type of relations are there, and that is what is important in homeopathy. Rather than we may not have much adverse drug reaction of the drugs like other Ayush systems like Ayurveda, Siddha, or Unani, because we are using in ultra high dilutions and lower potencies. And even the mother tincture also, it is much diluted than the herbal extract. So, but our concentration is to establish the remedy relations. So, what happens when you follow up with another drug, whether it is antidoting, whether it is having inimical relations, whether it is having any antidotal relations, whether it is complementary. So, such relations also will come in the preview of the pharmacovigilance as far as homeopathy is concerned. Now, another drug is Calmec, which is a very widely used liver medicine in mother tincture form. And report says that it can induce sterility in males and it cause abortion. Though we are not, most of the practitioners are not giving any mother tinctures during pregnancy. And I can say when I analyze the adverse drug reactions of the mother tinctures, I have studied about around 50 drugs, 50 commonly used mother tinctures in homeopathy, and most of the mother tinctures are contraindicated in pregnancy. Most of the mother tinctures. So it induces abortion. That is one thing I observed. And these are the references. And these are something I collected from different journals. Rolfia serpentina, which is I call it as a notorious mother tincture, uh, because it is very widely used mother tincture by practitioners, but we call it as a notorious mother tincture because of these things. And many things, impairment of sexual function in male, tranquilizer, bradycardia, salivation, lot more it produces as side effects. Though it reduces BP, but more it causes the side effects. Panax ginseng is a herbal drug. We thought it was a safe drug, and most of the practitioners are using this ginseng as a tonic. I have observed that when I interact with some practitioners, they give this ginseng as a tonic. It is having a histamine liberating property. In a sensitive people, it cause some reactions like asthma, or if the patient is having some respiratory disorders, it may produce some reactions. Now the last one is viscous album. This is also a very common medicine which is used for hypertension. The large doses of viscum proteins produce anemia and sometimes hemorrhage of the liver and intestinal hemorrhage. So I have selected only very few drugs which is commonly used. So at least 50 drugs I have studied about the adverse drug reactions, which is dispensed in a mother tincture form. Okay. So that is about the mother tinctures. Now coming to the lower potencies. So this is a limit of prescription according to the pharmacopoeia. Anti-Mars not below 3x, arsenic album not below 3x, arsenide not below 3x, prytidate not below 3x, digitalis not below 6x. So I have come across one prescription of giving digitalis tincture by a doctor. So that culture, that practice is not safe, and this limit of prescription is given in pharmacopoeia. So this is about the role of homeopathy, the pharmacovigilance in homeopathy, and as I said, we should more concentrate about the drug relationships, and the other observations after giving a high dilution. So what are the new symptoms observed? What are the unintended? One of the definition of adverse drug reaction is unintended symptoms observed during the course of treatment, unintended. So in that case, we can also observe any new symptoms is observing in the patient. So such things also is included as an adverse reactions. So thank you, all the participants.
Thank you, sir. There are certain queries.
Yes.
So, if you have asked for examples of adverse drug reactions with mother tinctures and potentized medicines, which you already discussed. Another one question is there a possibility of mistaking homeopathic drug adverse effects with homeopathic aggravation?
Homeopathic aggravation is different from the adverse drug reactions. Rather, we can relate to medicinal aggravation. Medicinal aggravation and adverse drug reaction can be comparable. But homeopathic aggravation, as the definition says, the generals are better, and for a chronic disease, it will be at the end of the towards the cure of the disease. Generally, the patient will be well-being. Only objective symptoms are aggravated. So there are some criteria for homeopathic action, right? And the medicine should be correct, isn't it? We can relate medicinal aggravation with the adverse drug reactions. We can very well establish the relationship between medicinal aggravation and adverse drug reactions.
Okay.
And the examples as a drug, because the list is very long. So that's why I have included a few drugs, important drugs. Definitely there are, we observed many adverse drug reactions in the, especially in the mother tinges and lower dilutions.
Okay, sir, there's another question. Does the overuse of mother tincture and adverse drug reaction resemble physiological action of the drug? Does the overuse of mother tincture and adverse drug reaction resemble physiological action of the drug?
See, as definition of physiological action is, it should be the medicine, if the mother tincture is given in a physiological dose. If the mother tincture is given in the physiological dose, definitely the action is physiological action, isn't it? So physiological action, by definition, it says that it alters the normal physiology, isn't it? So provided the medicine, the mother tincture, if it is given in a physiological dose. So many times we observe that we don't require to prescribe a mother tincture in a physiological dose. It is a sub-physiological dose. Sub-physiological dose, many of the condition can be managed. So if you give in physiological dose, there is a high chance of observing the adverse drug reactions, because it alters the normal physiology or sensations or functions.
Okay, sir. Sir, your view on adverse drug effects of external applications?
External applications, yeah, some of the drugs, like some of the very well established practitioners, I will give an example for that. For warts, they apply podophyllum. Podophyllum is a very effective medicine externally for warts, but what happens is it causes some ulceration around the ulceration of the normal skin around the lesion. So that is considered as one of the adverse drug reactions, because it is unwanted symptom, isn't it? Warts will be removed, but it causes ulceration in the part. So that is the one thing I observe. And there are some some people having some skin reactions to some oils, especially the Restox oil. Restox oil is commonly given for as an external oil for arthritic pain, but some people are sensitive to it, and they develop, the Restox is a very irritant thing, isn't it? So it causes some erysipelas, like eruptions in some patients. These are the things I remember. There are many. Anything else?
Some are considerate about the use of mother tinctures in case of diabetes and hypertension.
For hypertension, I told you, Rolfia is a universal drug used for hypertension. But so please be vigilant over the use of overuse of Rolfia. There are people who are using Rolfia for years, and some doctors told me that they are giving this particular medicine for a long years, but nothing happened. See, these adverse drug reactions may not be caused in all the people. For a susceptible people, it may cause. So please be vigilant that Rolfia is a most notorious drug, and many more. If you search in the PubMed or any other search internet, you can find a lot of symptoms which is caused by Rolfia. So You can use a better alternative for that.
Another question is, what is your opinion on the use of mother tinctures? In
My
which
opinion
cases
is
mother
that,
tincture works?
okay. So we have a definite criteria for using mother tinctures. We not always require mother tincture. Mother tincture is indicated in a special conditions for some sort of diseases, maybe for a palliative purpose. If you are using it for a palliative or for a incurable diseases or for just for a palliation, then we can use it in a sub-physiological dose, and whenever it is necessary, not use it for a prolonged period. And more important is you should have a watch on the patient. You should observe it. Any changes, any new symptoms, anything is happening. See, for example, I have observed one thing. When I give Califos 3x for a patient, for a patient, or old patient, an elderly patient, for a long time, and after 3 months, when I analyze potassium level in the blood, it was raised. So such type of things you need to do. We need to observe it. So that is the only advice I can give. So do not give it for prolonged period. Have a watch on the patient.
Okay. What if the adverse reactions or cost is a permanent one and the de-challenging is not possible?
Permanent one and de-challenge is not possible. See, this
Yes.
de-challenge and re-challenge is a criteria for assessing the causality. Understood? Suppose if it is a permanent change, and definitely it is certain, and we should aware about whether it is a plausible time frame relationship between this particular drug and the event. That is very, very important. If re-challenge and de-challenge is not possible, then the causal relationship between the particular drug and the event should be well established. Then only it can be considered as a certain. And it is very difficult to term a particular relation as a certain, probable, or possible. Several criteria are there.
Okay, another question is, a plant grown naturally and the same plant grown in a garden with fertilizers, does this have a change in the phytoconstituents and the adverse drug reactions?
Definitely have a difference in the phytochemicals. Usually we consider the plant which is growing in its natural habitat definitely have an advantage over it is cultivated. Then one more thing is, it is not only the cultivation but the time of collection, the rainfall, the climate, everything matters. And when it comes to the action of medicine, definitely the medicine which is found, which is grown in its natural habitat, having more action in the material dose. So that is observation. And not only the habitat, but it depends on the time of collection and the season of collection.
Okay. Are there any means to find out the genuineness of a potency, like whether 30C is actually 30C?
So far, it is very difficult, but there are some indirect methods used by. I think in Father Muller's also they conducted some experiments with in collaboration with Baba Atomic Research Center, and that is indirect methods. But directly, I don't think it is. There is no analytical method to find the identify the potency. So only thing in the homeopathy is we need to have a stringent standardization of mother products, mother tinctures, mother substance, and mother solutions. That is only way of standardizing the drug.
Another one concern is how to convince the general public the difference between drug aggravation and homeopathic aggravation. If people refuse to accept our view and say homeopathic medicines are having side effects.
No, it is not about the side effect, but homeopathic aggravation, we need to educate patients about generally patients feel better, but many of the people know that they are feeling better after taking the medicines. So there is a least occasion where we need to patients are worried about homeopathic medicine, but in fact about the medicinal aggravation or adverse drug reactions, patients will vigilant over it and they will complain to the doctor. After taking this particular medicine, I developed these conditions. So that is the reason why, because so far we don't have any database to analyze it, and that is the reason why government initiated the pharmacovigilance program in India to collect the databases. So my appeal to all the practitioners is you do observe the symptoms and do report this symptom to your nearest peripheral vigilance center, so that over a period of time we can develop a very good database and this generations. So that is the primary aim of pharmacovigilance. So that is the right way of doing that.
Okay. Sir, is the high potencies free of adverse drug reactions?
No, if you read the master's cautions about using high potencies, especially Kent, Clark, etc., Calicarb, then lycopodium, phosphorus, these medicines should not be used in higher potencies in particular conditions, not in all conditions. So there are some cautions which is given by the masters themselves. So we cannot assume that high potencies are free from adverse drug reactions. But one thing I observe is generally in olden days, doctors used to observe the adverse drug reactions. That is why in our most of the literature we can find these observations. But nowadays these reports are less. People are not worrying about the adverse reactions or any side effects, but only they concentrate over the effect or action of the medicines.
Sir, you had said about reporting. So here is one concern. Legal implications for the practitioner after reporting an incidence of adverse drug reaction.
No, nothing. There is no legal problems to those who are reporting the adverse drug reactions. That is very confidential, and practitioner will not face any legal problems as far as I concern. And that is a good culture actually to report. And if you see the any sentinel events happen in our institutions, we need to report it, and that is a good gesture of culture, isn't it? So that is a culture we need to develop, and there is no legal implications for practitioners.
Sir, what about the use of nosodes in lower potencies? Some physicians are found to use it in 30 potency.
30 potency is not a low potency. It is a medium potency. So it cannot be considered as a low potency. But in pharmacopoeia, they have limit. The nosode should not be used below 6x. That is a criteria given in pharmacopoeia, but normally people use it above 30 potency, and that is not considered as a low potency.
Okay. Is there any effect of the tincture in large quantity when come in contact with the skin, as skin is one of the route of administration?
That's what I told in before. There are some mother tinctures which is having some interaction with the skin. It may have some phytoconstituents which can cause some irritation in the skin. Some irritants are there. Some irritants are there. So like rustox and some of the herbal extracts, mother tinctures, especially from Anacardiaceae family. So these medicines can have some interaction with the skin. So that is why when you use a mother tincture as an external application, according to pharmacopoeia, we need to dilute it to 1:1 ratio. 1 part of mother tincture and 1 part of water, and we can make the lotions. So this is the direction given in pharmacopoeia.
Okay, so now as we are reaching the time is nearing to 9 o'clock. So one last question: tips for a beginner to prescribe mother tincture.
First thing you can understand is to be a flexible practitioner. We can use any potencies according to the condition, according to the case, according to the susceptibility. Any potencies you can see. Even Hahnemann used all the potencies. And especially mother tinctures, when you want to use, there are some criteria for using mother tinctures. It can be used for palliation, and we can use it in a sub-physiological dose, and many of the practitioners use it very well without continuing for more time. Prolonged use of mother tinctures are prohibited, and if you are giving a mother tincture to a patient, you should keep on observing the patient and asking for any new symptoms, any discomfort, any for example, there are observation. There are some reports from some practitioners that they are using some particular mother tincture, and the patient is having hemorrhage from anus for a long time, and they consider it as a hemorrhoids, but it was not a hemorrhoid. It was due to the intestinal bleeding after the prolonged use of this particular mother tincture. So such reports are there. So you should be very vigilant in using mother tinctures for a prolonged time in a massive doses. So this is my advice in giving in the prescription of mother tinctures. Whenever it is necessary, we can use it. That is for palliation, and it should not be used for a prolonged period of time.
Okay, thanks a lot, Ram Jyothis sir. And the comment box is getting filled with comments that it is a very excellent session and very well presented. And I'm sure that for majority of us, it is a completely new topic and a completely new information. And within the available limited time, sir was able to put up whatever things that are necessary for the practitioners as well as the students. So I hope everyone will be putting these concepts into your regular practice to help to make the homeopathic system a safer one. And now I request our principal, Dr. Shiv Prasad sir, for his conclusion remarks.
Thank you, Dr. Vivek Shaktidaran. Pharmacovigilance probably is a new concept which is started by Ayush Ministry focused mainly on Ayurveda, Unani, where there are some drugs which are of detriment to the body system. Because homeopathy also comes under the ministry, and also we are having some of the physiological doses which we are using inadvertently. Probably they might have included us also in this particular process. In fact, Father Muller's Homeopathy Medical College is also a peripheral pharmacovigilance center, and we have been working for the last 1 year. It's a doubtful thing whether it is to be reported and it has to be known. The functioning of it has been a confusion. But now today, Dr. Ram Jyothis, being an expert in the pharmacy department, one of the pioneers in the MD pharmacy department, and he has presented it very aptly, in a very simple manner, so that everybody could understand. This is a subject which is difficult to understand because of the homeopathic philosophy and its implication and the clinical practice. But still, Dr. Ram Jyothis has made it very simple and made his points very clear regarding the pharmacovigilance. Thank you, Dr. Ram Jyothis, for your presentation, and hope for better and better presentations, because you are the one who is into all the write-ups, articles and research presentations, and also being into lot of research protocols. Dr. Ram Jyothis, keep up with this. Wish you all the best, and thank you very much for your presentation on this day, the webinar series ProVision. Thank you very much on behalf of Father Muller's Homeopathic Medical College, charitable institutions, and all the members of the staff. Thank you very much, Dr. Ram Jyothis.
I'm expressing my thanks and gratitude to the management and the members of faculty of Father Muller's, and I always cherish the memories of my service in Father Muller's, and it gives me the strength and the knowledge, and the knowledge I got from the academics as well as the industry. I cannot forget it. Thank you once again, sir.
Thank you very much for your good words about the institution. And our administrator is watching this program. He also would understand. He would get a good number of points regarding various aspects of the pharmaceutical implications in the clinical practice and also in the research. Thank you very much. I also thank Dr. Vivek Shaktidharan for moderating this session so beautifully, and guiding the group members for their questions and getting a apt answer from our speaker. I thank all the participants who have made it possible today to a very unusual presentation, because usually we talk about only the clinical presentations, but Dr. Ram Jyothis is an expert in the Department of Pharmacy, and he has given this. And thank you for your participation in this program, and we'll hope for your participation in the days to come. The program goes on, a month-long program. Please be in touch with the webinar team and be a part of this program in the days to come. I thank the committee which has been working relentlessly and giving all the feedbacks and all the good program for this particular webinar series. Thank you very much. Good night. Stay safe. Stay at home. Thank you very much. Good night.